Mr. Jackie Doyle-Price.
Thank you, Mr Deputy Speaker, and I'd like to thank all contributors to this debate today, which has been marked by a lot of enthusiasm and passionate advocacy in support of improved mental health. I particularly obviously like to pay tribute to the Honourable Member for Liverpool Wavertree, the Honourable Member for North Norfolk and my Honourable friend, the Member for Plymouth Moorview, for securing this debate and, again, bringing their characteristic ambitious agendas to play, I suppose, and their well-informed and passionate advocacy on this behalf. Standing as I do, it is quite often challenging responding to all three honourable members, but on this occasion, I've really enjoyed listening to their contributions and agreed with much of what's been said. And I think we are all sharing the same objective here, which is to secure support as early as it can for people who are suffering mental ill health, and more specifically to enable more people with mental ill health to stay in work, because it's good for their health as long as it's good work, well supported, but it's also good for the economy that more people are encouraged to work. And the Honourable Lady, the member for Liverpool Wavertree, perhaps illustrates it most starkly by the figures she referred to with regard to those receiving care from Merseycare, which really brings into stark relief exactly the size of the challenge. The fact that only 3% of those patients are in work is something that perhaps we should all reflect on, and really does underline the importance of making sure that we get better at supporting and encouraging people into work if they're suffering mental health challenges. I'm very pleased also to be joined on the front bench by my honourable friend, the Minister for Disabilities. She's also responsible for the Health and Safety Executive, which has obviously got a big role to play in this agenda, and she's been listening very carefully to all members' contributions. She and I are united in an objective to make sure that we keep more people with all kinds of disability in work and get those that are currently excluded from the workforce into it too. And we have a wide package of measures that we're taking forward in that regard, some of which have been referred to today. So to reiterate, the government is committed to building a country that works for everyone, and that must include that disabled people and people with mental health conditions can go as far as their talents can take them. We do know that too many people with a mental health condition are not able to do that, and that is a burning injustice that must be tackled. We know, as the Honourable Gentleman, the Member for North Norfolk, pointed out, those people who are unemployed for more than 12 weeks are between 4 and 10 times more likely to suffer from depression and anxiety, which you're just looking at that particular statistic illustrates why it's good for society as well as good for the individual that we do tackle that. And the good news is that staying in or returning to work after a period of mental health really does aid mental health recovery. So it really does make perfect sense. Indeed.
Very grateful to the Minister for giving way. She'll be aware of the objective in the 5-year forward view to double the number of people who get access to individual placement and support. Can she indicate how that programme is going? If she can't now, could she write to me?
I can say we're making progress. I prefer to write to the Honourable Gentleman with more detail, if I may. But I have seen some of that individual placement support in operation, and I have to say it's hugely inspiring. For those mental health trusts that are really giving that one-to-one support, even some of the most challenging of cases can then find that person has the reward and the discipline of going to work. It really does aid their recovery. But I'll write to the Honourable Gentleman with more information on that. Yes, of course.
But could I ask her to liaise with colleagues in the DWP? Because as I raised with the Right Honourable Member for North Norfolk, is one of the access points, which is very helpful for people wanting to get back to work, is voluntary work. And the current limitations around being allowed to do certain voluntary work does hinder some people who want that route into work.
Well, I completely agree with the honourable gentleman, and my honourable friend was whispering to me that she does too. But quite often I think employers are risk averse about using voluntary work, and again, you know, we in government need to make sure that we're making it easy for people to apply those routes. But my honourable friend says she will write to the honourable gentleman on that matter too. A number of points were raised by honourable members throughout the course of the debate. On the issue of mental health first aid in schools, I can advise the honourable member for Wakefield, who's not in her place, that the government has a commitment to ensuring that at least one member of staff in each primary and secondary school does receive mental health first aid, and currently we've reached 1,537 schools with that. I was delighted to hear from my next door neighbour, the honourable member for Dagenham and Rainham. Like he, I'm very well aware of much of the activity of Ford, and it's good to hear what they've been doing in this regard too. My honourable friend, the member for Waveney, highlighted the work of St John's Ambulance in promoting mental health first aid, and again I'd like to commend their work too. And the honourable gentleman made an excellent point with regards to the fact that this is a cross-governmental point, and I mentioned obviously DWP we have here, but it was very much a message in the 5-year forward view that this was something that had to be tackled across government, and we remain focused to deliver exactly that. So just to put it in context, the Prime Minister has of course set out an ambitious set of reforms to improve mental health. We've heard reference made to parity of esteem, and I'd just like to reiterate to all members of the House, the fact that parity of esteem is written into legislation is not the end, it is just the start. The truth is that in delivering true parity of esteem, we have to manage a programme of behavioural change throughout our services and indeed throughout society. And frankly, I don't think any of us should ever be complacent about when or not we've achieved that. This is something that is going to take a lot of time. What's great is to see just how much energy is being applied to it. And we've heard a number of references to time to change, and it is very clear that that cultural transformation in society has been massively aided by time to change, and that destigmatisation is really helping to deliver. But nonetheless, we of course have a big role to play in terms of service provision. We are creating 21,000 new posts in the mental health workforce. We're implementing the first waiting time ambitions for mental health so that people have access faster to the care they need. We've just recently published the review of our mental health legislation, which is for the first time for a number of years. And of course, we are massively improving early intervention by investing in more services within schools. Yeah. So that's we are of course investing more through the 10-year plan. The Prime Minister announced that the budget would grow by over £20 billion for the NHS. And in terms of the NHS long-term plan, which was published last week, the NHS confirmed there will be a comprehensive expansion of mental health services with an additional £2.3 billion in real terms by 2023-24. And the ambition is that that will give 380,000 more adults access to psychological therapies and 345,000 more children and young people greater support in the next 5 years. So we're ambitious, and I'm not going to pretend that by putting parity of esteem into law, we've suddenly achieved it. This is a journey that we've got to do in terms of how we commission services, how we deliver them, and, of course, how we, across society, behave. So there's still much to do, and not least in the workforce. Destigmatising of mental health is contributing to understanding and challenging the prejudice and stigma, but we still need to do more. And we've heard much reference to the Farmer-Stevenson review, which was appointed by the Prime Minister to ask their advice about how employers can better support all employees to remain and thrive in work. And we set out a broad-ranging strategy to further support disabled people and people with health conditions, including mental health, to enter and thrive into work through our response, where we accepted all those recommendations, and indeed the Leadership Academy to deliver this met only this morning. The Work and Health Unit, which is jointly led by myself and my honourable friend, the Minister for Disabilities, will be overseeing progress with those recommendations. And those range from short-term deliverables to longer-term reform. That will include looking at potential legislation in due course. The key thriving at work recommendation is, of course, that all employers, regardless of size or industry, should adopt 6 core standards that lay the basic foundations for an approach to workplace mental health. The review also recommended that all public sector employers and private sector companies with more than 500 employees deliver mental health enhanced standards. These include increasing transparency and accountability through internal and external reporting of their performance against those standards. So the Prime Minister has accepted those recommendations to apply across the civil service and NHS England. The civil service, as an employer of 420,000 employees, really should be leading by example in this. And equally, the NHS, as both the provider of services and as a large employer, should equally be leading the way. The Government has also taken action to work with partners to develop a framework to support organisations to record and report their performance in disability and mental health in the workplace. And we published that in November of last year, a voluntary framework that highlights transparency in reporting as the effective levers in driving the cultural change that we need to develop. But we know that every line manager, supervisor and leader has a critical role in supporting employees to stay well and stay in work. And that's why the Work and Health Unit is also working with partners to identify the support and skills that line managers need across all sizes of organisations to create inclusive and supportive workplace environments. So we're exploring how we in government can share those examples of best practice so that all employers get better at this. And in truth, many of them will recognise that they need the tools to do the job, because no one knows what they don't know, and we in government have a role in spreading that good practice. So specifically on the issue of mental health first aid, we recognise that mental health first aid has a role in the government's ambitious strategy to transform workplace mental health. And mental health first aid is a helpful training resource that educates people not just to care for the others, but to care for themselves as well. It also helps improve understanding about mental health and mental illness, helps build that culture within organisations and better understanding, and it encourages people to stay well and get the support they need to manage any mental health symptoms and problems. But I was also very struck by what the Honourable Gentleman from North Norfolk said. On its own, it's not enough, and we wouldn't want to have legislation which became essentially a flaw of service in terms of mental health. A number of references were made to Thames Water and how the success that they've had in delivering mental health first aid, all of which is true, but the mental health first aid is just part of their embedding a supportive workplace culture to support those with mental health. It is not the only tool that they use. So, of course, they have introduced mental health first aiders across the business, but they've also expanded their internal clinical occupational health team to support the business in case management, health screening, health surveillance and wellbeing. And the occupational health team now processes, on average, 100 referrals a month, 98% of which are for non-work-related issues. And up to 80% of the cases referred every month are for those still in work. So that shows that they're accessing a more long-term care in terms of keeping them in work rather than just mental health first aid. And I think we do need to be very careful about really honing down on one simple measure of supporting mental health in the workplace, rather than actually encouraging a more holistic culture of supporting well-being. I can also advise the House that the Health and Safety Executive, working together with Mental Health First Aid England, has recently published revised guidance for employers on their compliance with the Health and Safety First Aid regulations. This guidance clarifies that for employers, the existing requirement to consider mental health alongside physical health is necessary when undertaking a first aid needs assessment. The findings from that needs assessment will help direct employers to decide what measures they put in place. It is the advice of the Health and Safety Executive that the recommendations of the Stevenson-Farmer Review also go way beyond just simply applying mental health first aid. So the government's view is that the best way to secure employer action to enable those experiencing mental ill health to remain and thrive in work is to engage with employers to adopt a comprehensive approach based on the Thriving at Work mental health standards. Mental health first aid is not an exclusive way of delivering employer action, but can form part of it. So, to improve information and advice for employers, we are supporting Mind and the Royal Foundation to continue developing their Mental Health at Work online gateway, which we launched on the 11th of September last year. This online platform is aimed at employers, senior management and line managers, but is accessible to anyone, and it helps them to find something that can help them support colleagues and challenge stigma or learn more about mental health in the workplace. There's a guided search tool which helps develop toolkits, blogs and case studies to help everyone in their journey to improve the workplace. Mental Health at Work is a UK-wide initiative and supports people across all workplaces, all sectors, all backgrounds and all regions. So in conclusion, Mr Deputy Speaker, by working with our partners, including health professionals and employers, this government is working to fundamentally change culture and professional practice to tackle poor mental health and ensure that disabled people and people with health conditions can reach their full potential not only in the workplace but across society as a whole. I thank all members for their contributions and for their interest in this subject. We do need to continue to discuss these issues and to encourage good practice. We've heard many good examples today, but we need to consider debating these issues so that we genuinely do foster a culture in work that supports those people with disabilities and mental health to get jobs and to stay in work. Thank you.